Hi everyone, welcome back to Face It with Dr. G. I'm Dr. G and we're going to talk about all things DTNs, delayed onset tissue nodules. And I am going to talk about a specific article that I think is really cool in the literature that was published relatively recently. It was in the Aesthetic Surgery Journal. And I'm going to show it to you here if you're watching on YouTube, making sense of late tissue nodules associated with hyaluronic acid injections. And I encourage you all to read this article, mostly to understand the background of what hyaluronic acid is and all the different factors that can go into these DTNs, because this word or this abbreviation is thrown around a ton. And this article was written by Greg Goodman, is the first author. There's tons of them in here if you can see this on YouTube. Last author being Terrace Poon, and it's phenomenal. So let's start with the basics. So the etiology and pathogenesis of these delayed onset tissue nodules has been controversial for years, and there is not much in the literature, but what is in the literature has been somewhat controversial, and it's important to understand these, but we have to start somewhere. So this article mentions there was a consensus group that was developed in Melbourne, Australia, and they started discussing what the etiology of these could be, and they hypothesized that it could be the filler itself, it could be the patient's immune system, and it could be an infection of some kind. So we're going to get into that, but let's first talk about what our native hyaluronic acid is. Hyaluronic acid is a glucosaminoglycan, and it's made of disaccharides. And when we produce hyaluronic acid in our bodies, it is produced intracellularly, and it is a long chain. So it is a high molecular weight hyaluronic acid molecule. And we don't have a very specific definition of what that means as this paper describes, but we are describing it, or they describe it as high molecular weight hyaluronic acid is 1,000 kilodaltons or more, and low molecular weight is less than that. So when we produce hyaluronic acid, we make it intracellularly. That HA is then transported outside of the cell membrane, and all of those disaccharides are combined and connected to create a larger, approximately 5,000 kilodalton molecule of hyaluronic acid. And essentially, that hyaluronic acid lives in our skin, mostly in the papillary dermis. So if you guys know my background as a dermatopathologist, I love all the layers of the skin. You have the stratum corneum, the epidermis, then you have the basement membrane zone, you have the papillary dermis, and then you have the reticular dermis, then you have the subcutaneous tissue. So the papillary dermis is the most superficial layer of the dermis. In younger individuals, it is shown that there is some hyaluronic acid higher up inside the actual epidermis, but mostly it's in the papillary dermis. So hyaluronic acid is broken down in the body over time, and it's broken down by our native hyaluronidase, the enzyme hyaluronidase. And if you've listened to my prior podcast on hyaluronidase, if you haven't done it, go listen to it because it's awesome. So we have Hyal-1 and Hyal-2, and these enzymes digest that 5,000 or so kilodalton molecule into approximately 50 kilodalton hyaluronic acid particles. And these are considered to be low molecular weight. And we'll get into why that matters, right? I'll give you a hint. It's a little bit more inflammatory when it's a smaller molecule. So once those small hyaluronic acid molecules are existing, our body says, okay, we need to digest them and get rid of them. That is called endocytosis, where the particles are taken up by cells, specifically lysosomes, and they're continually degraded and excreted. One factor is age. So our hyaluronic acid is broken down as we age. And the other thing is reactive oxygen species. So that's why we tell you to protect your skin, wear your sunscreen, and use your vitamin C's that are effective in reducing the intensity of those reactive oxygen species. So let's now move on to the immune system, because I did mention we are talking about those hyaluronic acid particles in the filler. We're talking about your immune system and then possibly an infection. So let's go to the immune system. So this gets into a little bit of molecular biology and some cell receptors. So what we believe is that high molecular weight molecules are signaling that we're happy people and the immune system is happy. They interact with cell receptors called CD44 and secrete these anti-inflammatory cytokines or signals throughout the body. So there is no upregulation of our immune system. This also helps with cell motility and maturation, and it's just wonderful. That's how we want things. In contrast, low molecular weight hyaluronic acid interacts with toll-like receptors, and these are actually inflammatory. So our body is upregulated on the side of the immune system, we feel more inflamed, and this is where we can get into issues. And the reason that this is important is that hyaluronic acid doesn't just sit without interacting with other cells and materials in the body. Hyaluronic acid signals widely throughout the body, and those receptors, either CD44 or the toll-like receptors, are how the hyaluronic acid is recognized in the body. So it's super important to understand that. If you just remember high molecular weight, H for happy, low molecular weight is the opposite, that we get into a little bit of a different situation and higher immunogenicity. Maybe that'll help you remember that. And when we get into viruses or bacteria or other infections, those are also pro-inflammatory, obviously, and can create different signaling to upregulate the inflammatory process in our body and the immune system. So I'm not going to go into a lot of detail on the consensus development. I want you all to read this paper. It's really great. It was discussed, I think, in 2019, they mentioned, and then a panel of 25 plastic surgeons was formally developed in 2022, and they posed a series of questions to come to a consensus on why they thought delayed type nodules were happening and how they occur. So go and read this paper, but I'm going to continue on with a couple other important points. So in general, the consensus group did agree that it's a triad of 3 different entities or issues that create these DTNs. And one issue that I think is important to understand is they've had a hard time clearly identifying bacteria, and this could be due to a multitude of different issues. It's been hard to definitively and accurately and consistently identify bacteria within these DTNs. So that's something to consider. The other thing is that they postulated that the immune response to a potentially commensal organism, or an organism that is normally on the skin surface, that reaction or response would be less than the response to a bacteria or virus that was more pathogenic and not normally on the skin, which makes sense, right? But how would that happen? So that's another hypothesis and agreement that it would be less immunogenic if it was passively transferred from the skin and implanted into the hyaluronic acid particle. The group also agreed that post-vaccination viremia, or, as we saw more DTNs with and after the COVID-19 vaccination, that viremia was associated with prolonged delayed tissue nodules. So that's something else to keep in mind. So as we've discussed the immune system, the or an infection, and the hyaluronic acid filler, it's important to understand that we don't know if one of those is sufficient to cause a DTN, and that still needs to be determined. Some believe that maybe the status of the immune system is enough to create a DTN, but what this consensus is agreeing is that we need all 3. So another concept is, and maybe you're thinking, well, there's endotoxin in these fillers because our hyaluronic acid fillers are created from a streptococcus bacteria. So that is true, but because of the purification process, that is so diminished that it gets down to about 20 units of endotoxin in that filler, and it's pretty much not an issue. That's what they believe. It has truly been shown that any injectable hyaluronic acid filler is non-inflammatory, and they've also stated and they believe that any cross-linking agent is also not sufficient to cause a DTN. I think that last point is interesting because when we have enhanced cross-linking, that is meant to enhance longevity of a product. And so it's an interesting relationship between how long that hyaluronic acid product is around and how long those low molecular weight hyaluronic acid particles are around, and how that affects DTN formation. And we really don't know. And at this point, we have different types of cross-linking, Vicross technology, etc., and we really don't see any difference, but I think that it poses an interesting question, and that's not discussed in this article. So I'll just leave that as food for thought for all of you to go read the article and take away what you want to take away from it. So overall, as the process, I want to clarify what we think and what this paper is saying happened. So you inject a hyaluronic acid dermal filler that is high molecular weight hyaluronic acid, and over time, those hyaluronic acid particles are degraded into low molecular weight hyaluronic acid particles. The high molecular weight are happy, they're non-inflammatory, and the low molecular weight are a little bit more inflammatory. So potentially that product, that hyaluronic acid, is seeded with some sort of bacteria that could be from a systemic infection, or it could be commensal from the skin, which I find is probably the most probable from our situation in aesthetics. That's why we want to cleanse and cleanse and cleanse again. And that hyaluronic acid is implanted on the periphery with a little bacteria, and it can stay there inertly for quite some time. But then as the hyaluronic acid is broken down into that low molecular weight acid particle, that bacteria gets a little irritated, and your inflammatory system is now enhanced, and you get recruiting of macrophages and lymphocytes and foreign body giant cells that are now saying, what are these hyaluronic acid particles? And now, oh, there may be a virus or a bacteria here that I'm recognizing as well. And that's when you start to develop and encase, they're called these nodules because the inflammation is encasing that hyaluronic acid particle to try to degrade it, protect it from the rest of the tissues in the body, but to try to degrade it and get rid of it, excrete it. So that is the process. And there are still so many questions, but I loved this article because I think that it really goes into the details of hyaluronic acid and what it is and what we're seeing and why, but we don't know the time frame. We don't know how long it takes. Some people will see delayed onset nodules with virulent bacteria or viruses within 1 to 2 weeks of injection, but oftentimes they're much more delayed than that, and it takes a long time, but we don't know how long that takes. So that's important to understand, and we need to do more research. They mentioned that the timing and the degradation of the HA can be due to multiple factors, and it can vary based on those. I'm going to read them to you. It includes things such as the tenacity and quantity of the cross-linking utilized, the volume of product utilized in each treatment session, the original molecular weight of the hyaluronic acid, and the concentration of hyaluronic acid in the product. So there you go. There's so many different factors. I think also our immune system has a lot to do with it, and if we're immunocompetent, immunosuppressed. And I hope this was helpful for you all. I'm not going to go into treatment options. This paper does discuss treatment options, but I'll tell you the title again so you have it. And it's called The Making Sense of Late Tissue Nodules Associated with Hyaluronic Acid Injections. It's the Aesthetic Surgery Journal 2023, volume 23. And if you need a copy, shoot me a message, let me know, because I have it. It's fantastic. I hope this was helpful. Share it, subscribe, all the things. I cannot wait to see you again soon.